Hi, I'm Derrin Kluth. I'm a physical therapist here at Myofascial Release Mississauga, and I've been practicing John Barnes Myofascial Release for 10 years. My specialty is a unique approach that not only treats, but also empowers the patient to make lifestyle changes in order to get back to what they want to do. And I like to do this in two ways. The first is that after treating, I like to educate the patient on how they can do their own self-treatment to carry forward the gains that we get in clinic and get better at that skill and get better over time. And also to figure out what may have brought on the problems or contributed to bringing on the problems in the first place, like bad postures or bad ways of using the body. Even how we adjust our desks or use tools can have an effect too. And by taking care of that, we can prevent the problems from coming back by not doing the things that brought them on in the first place. My clinical doctor really was focused on figuring out why things were happening in the body. And I've added to that all my years of fascial experience to figure out why in chronic pain that the fascial system has been changed in order to create what we're calling chronic pain. What you can expect when you have a visit with me, the first visit is I do an assessment. So I do a lot of asking you what you're feeling and giving me details of the history, because I use a lot of that to inform the next part, which is the physical assessment. So I may have you move your body, I may test your strength, I may do what we call special tests to kind of rule things in and rule things out. But we take all that information and we put it together, and then I kind of palpate through your body and find out, what hurts, but also how is it connected to other areas that may hurt, or even other areas you may not know that are part of it. And then we start treatment. So treatment is hands-on. And I would say probably the assessment may take somewhere between 15 to 30 minutes, depending on how complex your problem is. And then we would spend the rest of the time, whether it's an hour, somewhere around to an hour and 15 minutes of hands-on treatment. And at the end, I would usually teach you how to do the most simple of the fascial releases using a rubber ball that we give you, and any immediate things that are important for starting to change how you use your body that may be contributing to things, to your problems, such as, teaching you how to set your desk up properly so you don't have neck pain, or how to, use your body to lift something or move so that you don't bring the symptoms back and then make them worse. Follow-up visits usually are an hour to an hour and a half. Some people like the hour and a half. And basically I'll spend roughly 10 minutes in the beginning kind of asking you how have things changed, picking out any important information that I may then go and look for in your fascial system, or see how you may have changed your motions, and talk about making those better if necessary, or reiterating what you've been doing right for your own self-treatment or those changes we talked about. And then roughly 45 to 50 minutes of the hour would be more hands-on, and then again at the end I would teach you the next thing to treat yourself, usually with tools like the Theracane you may have seen, or even using things like a broom or a mop around your house, you'd be surprised, or a hairbrush. And then also progressing exercises or again teaching you any new things you might need for your postures, motion patterns, things like that. I've seen all kinds of patients with all kinds of problems over my 10 years of doing this. I like to have the people who have multiple problems around the body and figure out what's going on, and then help you get back to normal. Sometimes people will have nerve compression symptoms, so that can be weakness, numbness, tingling, sometimes the shooting pain from the neck or back or other areas. Those are all part of what I like to do and solve. I like to treat people who are motivated, like to be educated about their problem and be empowered by that education, and people who enjoy the process of taking control of a problem and doing the work to make it better and better, to see that wonderful outcome of getting back to doing what they used to do without their pain and problems. I also send my patients a invitation to an app I use in order for them to remember what I asked them to do in clinic, so you don't have to remember everything and memorize it, so you'll always have a reference. And I found that really helps people do what they need to do at home to get better. So I like to tell all my patients that if somebody is really serious about myofascial release, it's best to try to do 2 to 3 visits a week for at least the first 4 weeks, and then we can decrease as necessary from there. That being said, you can get significantly better with as little as 1 time a week, especially if you're willing to, kind of do some of the self-treatment between sessions. And a lot of times people will feel 70 to 80% better within a couple of weeks, and and we just kind of do the rest from there as necessary.